Good morning, everybody. Thank you so much. So first, let's go into some background information on North Carolina and some underlying factors as to why I still believe that cardiovascular disease is still an ongoing issue in North Carolina for not only these past few years, but for the past 40 years. In 1977, the estimated population of North Carolina was 5.5 million. The annual report census last year concluded that there were 10.7 million residents. So now we're going to go into the brass tacks and strong facts of North Carolina and cardiovascular disease. That means we're going to hit where it hurts, and we need to talk about this issue. I created this infographic just to show people and show our community what has been going on in North Carolina. So I'm not going to spend too much time on this because I've already presented it before, but let's just go over the big facts. Since there are 10.7 million people in North Carolina, and 7.9% of them have cardiovascular disease that are adults, that means that almost 800,000 people, adult males, have cardiovascular disease. And for the 5.3% of adult females, that would be roughly 500,000. That to me is so crazy to believe, that so many people could have a disease in such a growing state. There are also lower socioeconomic factors that go into it that do question it, especially with insurance, education systems, and Medicare options. Now, something that I am very hard pressed on is the smoking and the poor diet, physical inactivity, and drugs that correlate to developing CVD in North Carolina. Opioid pandemic or epidemic is becoming huge. Poor diet, lack of exercise, and smoking are huge factors that we talked about recently that go into this. Now, in 2017, 4.7 Now, here's something that I would like to address to you all. Our audience is going to be our biggest takeaway of how we can get people on board. So I start at the top, I work my way down, one being the least important but still very important, number 10 being the highest importance. Hospitals in North Carolina treating our patients. We need to treat them better. We need to become stronger. I'm not in a hospital every day, so I don't see how our patients are being treated, but since in North Carolina we accept people that have insurance and don't have insurance, I can't imagine equal care being given out every second of the day to every patient. We need stronger support groups for cardiovascular disease, and we need stronger data research groups. We have a great public health system in North Carolina, but unfortunately it's just not strong enough to spend more time focusing on cardiovascular disease. We have so much that we get to look to. So my goal is to reach out to the World Health Organization and the Centers for Disease Control and Prevention, maybe the American Heart Association as well. Going back to these support groups, we need short and long-term care facilities that are going to take more initiative in helping those with cardiovascular disease. We also need to set up better funding. We have plenty of government funding for the beginning of each year, but it doesn't last the entire way, which means that sometimes we have to stop our research because we don't have the allocated funding. We need that. We need that support from health and first aid charities and sponsors. Now, as we go down, we go to insurance providers and medical professional volunteers. The cost of insurance in North Carolina is outrageous. We need to try to get a grip on that and talk to people that can help us. And now these medical professional volunteers, I don't mean that they need to just take time out of their busy life and help us more. What I mean by this Lastly, I'll go into my dissemination plan. We need to strengthen our community involvement. I will preach that daily. We need to try to talk to politicians and government officials about lowering health insurance costs. We need to work with these organizations like the World Health Organization, the Centers for Disease Control and Prevention, the American Heart Association, and heart.org. We need to try to push these big tobacco companies out of North Carolina, and we need to get the community more educated on nutrition and exercise. Obesity is still a huge factor